there's so many stigmas, especially in minority communities, when it comes to mental health as weak and stuff like that. And when I was able to go to a psychiatrist as an adult, psychologist, excuse me, as an adult, it was life changing for me. And I've been trying to spread the word amongst the community, but sometimes people pay attention, sometimes it falls on deaf ears. So, do you see that? Like, do you understand that with brown and black people, mental health seems to be swept under the rug versus dealing with it straight up?
Absolutely. And, not just for, us minorities, but, people in general, mental health, slowly but surely, as you know, that stigma is getting better. And luckily, these days there is a little bit improvement in terms of mental health services. And more importantly, people, medical professionals, and just society in general viewing mental health as just like having a medical issue, whether it's diabetes, high blood pressure. So those are things that I think slowly but surely we're going in the right direction.
So let's talk about mental health during COVID. What did you see? What do you understand? Talk to my audience as though you're speaking to them about them.
Absolutely. So, 2020 for everyone, different, people from every different walk of life, no matter what color you are, no matter what background you are, no matter what your financial background, has been tough. And of course, with the pandemic kind of coming in and kind of, slapping us a lot, to the, trying to figure out how can we appropriately deal with this. For a lot of people, that took on a financial burden. For other people, it's even being isolated, at home, and just being isolated at home, not being able to interact with others and feeling, alone. That's something that we've all been affected by, every, different aspect of COVID. So that's something that definitely, what we've been trying to do as a, mental health provider is to make sure to reassure people that we are here for them. And even, these days doing what we call telemedicine visits, I'm sure even with other therapists, other medical providers, being able to virtually have, that level of support, I think has been, very helpful. But 2020 has been that challenge, and we're still facing that challenge. Hopefully, knock on wood, things will get better for all of us. But I don't think that's going to happen, here tomorrow. So that's why we all need to try to be resilient and realize we need to look out for ourselves and take care of ourselves throughout this.
I want to get into something that's always intrigued me. I don't know if it's something I read or a discussion that I had. Specifically to black people who went through slavery, right? I always said this, when people would want to criticize how black people act or react or the rage or, they'd always put the super, words based on how black people respond to things. And I always thought this, like, having gone through slavery and discrimination at its height, back in the days, I almost felt, not being there, but just understanding, I almost felt like it was like, oh, you were a slave and, your forefathers and mothers were raped and this and all this and everything that you had was taken from you and all this. And then it's like, oh, slavery is over. All right, get over it. I don't think that black people ever had a moment to heal and reflect and had that opportunity. It was almost just like, oh yeah, Juneteenth, you straight now, right?
Sure.
Let's go. What's your heritage? You said Indian. Was it like East Indian or West Indian?
Yeah. So East Indian, I'm first generation. I was born in the States. My parents are from India. And Papa Keith, you'll get a kick out of this. I have an older brother who's also a physician, but even my parents sometimes are like, how come you're not a real doctor? I'm like, Mom, Dad, I have an MD behind my name. So, but that tells you the reason I'm saying that, because that tells you culturally, not just, obviously with our, my island, peeps down here and patients I run into, it's cultural background, recognizing that mental health is the same as just like seeing your doctor to get your blood pressure checked, your blood sugars checked. So that's always a story I taught.
Suicide. It seems like, I was watching a comedian the other day, he makes jokes about it, saying like his kids are soft as hell. You know what I mean? But, you know, we talk like that. Like back in the days, you had to be tougher and, you know, and you went through more and stuff like that. And where now it seems like, you know, more younger kids that they can't really deal as much. You know what I mean? And, you know, when life hits them a certain way, they're ready to commit suicide, which is, you know, of course, an unfortunate thing. Uh, have you seen that? Can you speak to that?
Absolutely. And, of course, it's something we're aware of, at times, this is kind of my personal 2 cents, Papa Keith. It seems at time, whether now media being compared to when me and you were young, where we just had the radio, the TV, no internet, no social media is the key of this conversation. So now what we're finding is young folks are trying to, fit in, getting where they fit in and, striving so hard to do that and having unrealistic expectations of, hey, this is the way I should look. This is the way I should act. This is the way I should dress. And that's why at times I even feel that it's even kind of glorified. And, when I use glorified, I mean that it's just pervasive in terms of everywhere in the media, in terms of that show on Netflix about kind of glorifying suicidality, the teenage show, I forgot what it was called. And, that's one of the things that we see. But I think social media and what our young folks really have access to these days really, kind of puts that where bullying, online bullying, cyberbullying, those things, put people really between a rock and a hard place, especially our young folks.
So it's also trying to understand what each generation is going through.
Absolutely.
You know what I mean? So like, if my father was trying to understand what I'm going through as his child, and if I'm trying to understand what my son is going through, it's those little blockades in between a generation that we need to break through as well. To remember, maybe I guess like what I went through, and like my father didn't listen to me, or he was too rough with me, so maybe I should try to find a balance with my son. It gets so complicated, man.
Absolutely. And that's the thing. And I think, bridging the gap between generations is something that we have to do, especially for the younger generation, and especially our parents out there being, vigilant. And I know, our teenage, kids out there, hey, dad, you can't check. That's a little too invasive. You can't check my online. But I think that's the name of the game, to try to bridge that gap and that generation gap we see. And it happened from our parents to us, and now from us to our kids, so on and so forth. And I think that's such an important thing to recognize and even intervene if need be. I want to thank you again, Papa Keith, for the opportunity. But basically, mental health, I think, is something we all need to pay attention to, and also recognize within ourselves that there are resources out there. And I do, once again, mypsychiatrist.com. We're located here in South Florida with 2 locations with multiple mental health providers. And remember, seeing a psychiatrist, seeing a psychologist doesn't necessarily mean medication. Medications, if need be, is a very small part of that equation. So that's something that I just want to pass on to the crowd, that, seek out that help. Just like you hurt your leg playing ball, just like, my joints are getting old. Anytime I try playing basketball, I almost hurt myself. Remember, people are ready to see a doctor for those types of things, or if they're feeling a little, under the weather. But that's where seeing a mental health professional, if you are feeling, your life is just not where it should be going day-to-day functioning, it's something that, people should not be ashamed of. It's just like any physical illness.